Hi, welcome everyone. Good afternoon. My name is Trishana Holman, and I am the Health Ministries Leader at the Metropolitan Seventh day Adventist Church. This afternoon, we would like to welcome you to our Black Health Matters. Of course, in our day and time, it is a challenge for our community, for our corporations, for us as individuals to be coping with the health disparities that we currently face. I just want to say I'm excited that you're with us this afternoon, and we are here to analyze the socioeconomic and racial barriers to accessing healthcare. I want to say a big welcome to, on behalf of the pastor and the leadership of the Metropolitan Seventh-day Adventist Church, and of course, the health committee members. Welcome. Please stay to the end. We have many prizes and surprises that will be given away today. And also, on our call today, we have Dr. Watkins. He is one of our panelists. Dr. Duan Drakes, Mistress Ursula Roberts Allen, and I know it's going to be so exciting. I can't wait. As you see, I tried to create my sign, Black Health Matters. And so get relaxed, enjoy yourselves. One reminder, you need to register to be eligible to win a prize. So you can go to the Metro website. There you will see a registration form where we will have your name and contact number so we can know where to send your prize. As a health ministry leader, I feel it is important that the Black church is engaged in every level of society. It cannot and must not be left out of decision making or denied a seat at the table. Whether the Black community is celebrating or struggling, it will turn to the Black church for leadership. It has become the social translator for the Black community, which is important in order to make sure that all in the Black community understand his or her role in creating community and sustaining our nation's integrity. You can be a part of this glorious experience in making sure that your organization understands how the Black church can work effectively to combat some of the social ills that govern our society. Welcome and enjoy our program today.
Good afternoon, everyone. We are so glad that you joined us this afternoon for this very special session. I'm so excited and grateful for Metropolitan Health Ministries actually pulling together the expertise and actually conducting this program for our wider community. We do understand that we are in some very turbulent times of economic distress and social distress, and the importance now for the church to actually take a stand and to speak out on issues of importance for people of all races, faiths, and nationalities is underscored right now. I'm so glad that in this time of racial reckoning that we have going on all throughout society, our voice is being heard and our voice is not silent. And today the discussion, the subject is Black Health Matters. If Black lives matter, then the health of Black people is important. And we've got to make sure that we are providing the delivery systems and the quality of care in our communities that our people have been historically denied. And so I'm grateful for all of our medical professionals that are here today. Want to welcome Sister Ursula Roberts Allen, Dr. Duan Drakes, as well as Dr. Ted Watkins, and the rest of our medical team that is here to speak on this very important issue, this subject. We encourage you. This is being recorded, so also share this with your friends and family so that they can be a part of being educated on what they can do to make a difference in our communities and bringing adequate health care to the members of our community. I just want to begin with a word of prayer, and then I want to turn it over to those who are going to lead us. Let us pray. Our Father and our God, we do thank you today for what you have done. We thank you, Lord, that red, yellow, black, and white all are precious in your sight. But today we recognize that amongst your most vulnerable right now are people of color, are Black people. And so the conversation today is about the health of Black people. We ask, dear God, that you would lead us in this conversation, and then may we be people of action that go out to be the hands and the feet of Jesus for those who need it the most. We thank you for your presence today. In Jesus' name, amen. And before I sign off, I just want to say a word of affirmation. Can we all give it up and just celebrate our Metro Health Ministries leader, Sister Trishana Holman? Sister Holman, we thank God for you, praise God for your leadership. And we are praying that God continues to be with you as you seek to guide us higher, move us along as we seek to be relevant in the space that God has placed us. God bless you, Sister Holman.
Good afternoon. My name is Kathleen Coleman, and I have the privilege of directing the Faith Community Health Department for Adventist Healthcare. And it is my privilege today to partner and support all local congregations of all faiths, but specifically today, to partner with Metro as we have done for many, many years. You know, since 1995, Adventist Healthcare has understood the importance of the African American church, all churches, to the health of their members and the surrounding community. And so we come today in full support of this program. Metro Church has been a shining star within the Adventist Healthcare Network. And I am so grateful that they had the vision to step up to the plate and to organize this much needed program today. We are in for a wonderful session, and we trust that you will be better informed and inspired to do more to live a healthier life. Just remember, Black lives matter. Your life matters. God bless us in our special time here today.
Hello, good afternoon. My name is Odell Busu, and I will be the moderator for this afternoon's program. This program, of course, is brought to you by the Metropolitan Health Ministries Department, which I'm a part of. I'm happy to be the moderator this afternoon. This, for me, is a call to action to identify and address racial and ethnic disparities. Black communities, as you know, in the United States are bearing the brunt of the COVID-19 pandemic and the underlying conditions that exacerbate its negative consequences. The coronavirus disease 2019 or 2020 pandemic has significantly impacted and devastated the world. As the infections spread, the projected mortality and economic devastation are unprecedented. In particular, racial and ethnic minorities may be at a particular disadvantage, as many already assume that the status of marginalized group. Black Americans and Blacks on a whole have a long-standing history of being disadvantaged and being in vulnerable position. So this afternoon, our panelists will discuss Black Health Matters and the role the church can play, the Seventh-day Adventist Church, Metropolitan Church, can play in helping to reduce some of these disparities and reaching out to our communities. Our panelists are Dr. Duane Drakes, who is a cardiothoracic surgery specialist in Washington, D.C., and has over 40 years of experience in the medical field. He originally hails from the large island of Barbados. He graduated from Howard University College of Medicine and subsequently completed his residency program at both Howard and the University of Alberta Hospital in Canada. Not only does he practice in the United States as a surgeon, but he has also shared his medical skills as a volunteer in several church-based mission trips abroad, as well as lecturing locally on topics and promoting cardiovascular health. I know him personally. He's a friend of mine. We have been friends for a number of years. Welcome, Dr. Drakes, to our forum this afternoon. Our next panelist is no stranger to us, to most of us, Miss Ursula Roberts Allen. She is the sixth of 7 children and was born on the island of St. Croix, U.S. Virgin Islands. She attended both the University of the Virgin Islands and Howard University and is a registered nurse. She's currently pursuing her doctoral degree at Walden University. She reports that she has 2 gifts in her life: the privilege of being both a wife of 25 years and a mother of a son who collabors with her in the missionary service. She has a burden for addressing health issues affecting the African American community. And aside from these numerous roles, she also serves as the executive coordinator for the Adventist Club for the Allegheny East Conference. And our special guest this afternoon is Dr. Theodore Watkins, Sr. We want to say a special welcome to you, Dr. Watkins. Thanks for taking time out to be with us and to share with us. Dr. Watkins is the medical director of the Watkins Institute. He's a recognized authority in preventive health and wellness. He believes that his patients are taught the principles of healthy living, diseases can be reversed, and/or the lifespan can be increased. Dr. Watkins is an alumna of Oakwood University and Howard University College of Medicine. Dr. Watkins' practice is one that incorporates a holistic approach that embraces spiritual, mental, and physical reformation. In 1986, Dr. Watkins participated in the White House Conference on Barriers to Delivering Healthcare to the Indigent. He also participated in the American Enterprise Institute Conference on Financing of Healthcare to the Indigent in 1987. For these reasons, we have invited him to present on the topic addressing barriers to accessing healthcare for our Black Health Matters program today. I want to say welcome to all of our panelists. We thank you for coming, and we will open. We first have Dr. Watkins, who will do a 15 minutes presentation, followed by Mrs. Ursula Allen, who will do a presentation for 10 minutes. And then we'll have Dr. Drakes, who will conclude with another 10 minutes presentation. Thank you very much, Dr. Watkins. The floor is yours.
Thank you so much, M.O.V.E.S. I'm excited to be with you, and I'm especially excited to talk today about the importance of Black Health Matters, because Black health does in fact matter. We know that even if we get rid of all of the racial disparities with our police, if we change many of the laws that adversely affect Blacks in this country, we will still be the leaders when it comes to dying from heart disease, diabetes, kidney failure, cancer, etc. Because these are diseases that negatively impact our society, our community. Now, we want to talk a little bit about some of the barriers to health care in this country. You know, a barrier to healthcare is really anything that can restrict the use of health services by making it more difficult for some individuals to access, use, and even benefit from healthcare. There are several types that are commonly discussed in the literature: intrinsic and extrinsic barriers. Some of the intrinsic barriers, these are barriers that really come from within. You know, if you don't know the availability of the services, you can't very well use them. And then many people in our community and other communities are afraid of the system, and they are afraid for good reason. They mistrust the medical system. We think about the Tuskegee experiment. There's a lady, Dr. Washington, who wrote a book last year outlining the terrible things that happened at Tuskegee and how it was perpetuated by many of the universities and so forth in this country. Then there's this fatalism where people feel that it really doesn't matter if they get health care. They're going to die anyway. Part of this has to do with self-esteem, self-image, and we can do much to help prevent that. And then there, of course, are some extrinsic barriers. You know, one of the major ones is cost. You know, medicine costs a lot of money. Then there's some cultural differences, language. I recently started seeing a patient that is a French-speaking patient, and unfortunately, I did not listen to my mother when she tried to get me to learn French as a little boy, and so I did not master that language. Fortunately for me, I have a patient that is a nurse and is quite fluent in French, and so she's been able to help me. But many doctors, many health facilities do not have that ability. And then there's some just physical barriers to access to the community. And many of the laws that have been passed tend to or have helped to remove some of those barriers, but yet still there are barriers that occur. And then we look at the providers themselves, the physicians, the nurses, the medical personnel, some of the factors that race, culture, sex and sexual orientation really still are issues in this country and affect the health delivery system. When we look at costs, you know, lack of insurance, lack of employment, and they can often go together because much of the health insurance in this country comes through our employment. If you don't have employment, then you don't have health insurance. Just to get an idea of what healthcare costs, in 2018, we spent over $1.7 trillion, $1.7 trillion on healthcare. And I would love to say that we've gotten our money's worth, but if we look at it, we're still dying of the same diseases that we were dying when we were only spending $1 billion. Now, COVID-19 has added to the problem because there's additional loss of jobs. There's also the lack of availability of services. Many offices have been closed. You know, I and many other people are now using telemedicine to try to give care to the patient. And this has helped a great deal. But one of the things that we realize is that some people are challenged, are technically challenged. You know, fortunately, my son is helping his old man. So, you know, I've been able to step up but many of my patients can't. I often have to coordinate seeing my patients with the availability of their children or their grandchildren. And so this is a major, major factor. But I want to suggest to you that the real barrier to health and health care is our orientation. Whether we're going to use follow a man-oriented worldly approach, or whether we're going to follow a spiritual approach. And the real problem when it comes to health care is that we must understand that the purpose of health care is that we are to be healthy. The Bible says, I wish above all things that thou mayest prosper and be in health. And that text goes on, even as thy soul prospers. And so it's very important that we understand what we're doing and why we're doing it. And so what we find is that one of the big barriers to really giving the kind of health care that is needed is our lack of knowledge and our lack of understanding. We need to recognize that 9 out of 10 of the leading causes of death in this country is not due to lack of access, but due to lifestyle. All right, there are certainly times that we need to be able to access the traditional, what we call traditional healthcare systems, and we need to remove all of those barriers that prevent people from getting access. But the Bible says that this you should have done and not left the other undone. We need to recognize that there are other barriers that prevent people from actually getting well, that they can go to the doctors and they'll start off with one medicine, 2, 3, 4 different medications. I've seen patients come to me with 4 different medications for hypertension and their blood pressures are still high. And so there's something more that we need to do. We've been blessed in that God has provided for us special information, and we have an opportunity to really proclaim the truth of the health message that God has given to this church. It's amazing as you go back and you start reading over some of the materials. I know because of the fact that we were beat up so bad growing up with the writings of Ellen White, I didn't want to read what she had to say in terms of some of her books on health. But last year I said, I really need to go and I need to look at this book. I'm talking about health. I'm talking about how to prevent. And so I started reading some of her books, and it is amazing, not only what she adds to it, but also to understand how God views health and how God views us taking care of ourselves. We're to love God and we're to love our neighbor, but we're to love our neighbor, as we love ourselves. And if we don't take proper care of ourselves, I don't think that we really can say that we love him. And so there are many barriers to health care. And we need to recognize that we can remove those barriers. We can fight to change the laws, but we also need to fight to change attitudes in our church and even outside of our church, because we have a true blessing that we aren't taking full enough advantage of. When I was practicing traditional medicine, my background was surgery, and I thought we could just cut it out. We would be asked to see a patient on the medical unit, and we would tell them, get out the way and let a real doctor come in. But when I switched over, diseases that I found incurable using traditional methods, whether surgery, medicine, or any other modalities that were available, could be prevented and reversed using the principles, the methods that God has provided for us. King Asa, the Bible says he became exceedingly sick, but in his sickness, he sought not the Lord, but the physicians. And when I read that at first, I became a little disturbed. I said, Lord, did I waste all this time going into medicine? When I should just pray for people. And then I read in a different version, it says that he sought only the physicians. And so it's important that we utilize our healthcare system, but it's also important that we don't forget that God is truly the great physician. Thank you very much.
This afternoon, I was asked to speak to you from the perspective of the frontline care worker, the nurse. And I wanted to share with you what we as nurses see. As a nurse, I started my career at Howard University on the cancer unit and got really internally stressed to the point where I was going to the doctor and he couldn't figure out what was wrong with me. And finally, when I told him I was going to at least 6 funerals a month, he's like, you need to change your job. I left there and went to the ICU and saw even sicker patients and realized that in all my nursing, I still really wasn't addressing and meeting my goal, which was to make people, help people to stay well and be better. Currently, I work in home health, and that gives me the opportunity to not only assist people who are getting better, but also impact whole families in terms of the wellness process, but also the staying well process. As a nurse, one of the first things we learn is about Florence Nightingale. And I bring her up because what she gave to healthcare was that the organism in which we are is at the forefront driving our healthcare. We are the organism that drives the need for our healthcare. What Florence found when she went over to deal with the soldiers who were sick at the time was a facility that was filthy, hygiene was poor, nutrition was almost non-existent. And although initially they did not want her help, they sent her to the kitchen. And there she found a room that was filthy. And her first task was to clean up. So she cleaned up the kitchen, she cleaned up the hospital, and brought in clean linen, fresh air, and good food. Today, our challenge as nurses on the front line dealing with Black Americans, Black individuals from all walk of life is that in applying nursing to care, we first have to go back to the beginning and recognize that we are dealing with the organism that is man. Now, there are two theories out there that goes against us, especially as Blacks. There's the germ theories and there is the genetic theory. The germ theory says that the germs in our environment is making us sick. The genetic theory says that it is locked in your gene what you have. And today I would just like to tell you that germs were created by our maker to help our bodies function, meaning that you've got a whole lot of germs in your body already. They perform functions that you and I would not in this lifetime begin to understand. But what makes us sick? What makes us sick is when our bodies are not functioning the way it should. And when I address Black care here in America, I have to recognize that as Black people, folks are asking, why is Blacks affected more than everybody else? And some folks are saying, why are you trying to blame everybody else for Blacks? And what does slavery have to do with me as a Black person being sick? Well, it's locked and loaded. When we as individuals were born, we were given DNAs from both our mother and our fathers. Unfortunately, because of slavery, our forefathers were deprived of good nutrition, causing mutation in the genes. We need good protein, good fats, and good minerals in order to be who we are supposed to be. When that does not happen, we're working on a system that's flawed. When you look at healthcare here in America, our problem is that when you go to the doctor, they're coming from a medical model. And as the nurse going out, my job is to teach you how to take the medicine that they've given you. I've gone in to see patients where I've got 4 reusable shopping bags of medicines, meaning that he's gone to different doctors all over the place and they've given him all this medicine, but he's still sick. On the flip side of it, they're telling us to teach them about good dietary intake. It really took one of my patients saying to me, Miss Allen, I've got to feed my kids, keep a roof over their heads, and I'm working 3 jobs to do so. So I shop at the dollar store. And when she said dollar store, I was like, what do you mean you shop at the dollar store? She said she shopped at the dollar store. So I walked by a dollar store and said, let me go in and see what she's talking about. In the dollar store, she can get everything she needs cheaper so that it can fit into her budget. Problem is, it's all processed, it's all prepackaged, and there's no fresh fruits and vegetables in there because it doesn't fit in her budget. The other thing is, if you give them medicines, the medicine that you're giving them, they have to balance buying the medicine versus paying the bills, keeping the lights on. And those are some of the major challenges that we as Blacks face in providing care. So, as a nurse caring for the community, the first thing I have to do is to get to know and understand my patient in a non judgmental way so that I can provide for them the things that they, one, can afford, and redesign a healthcare package for them with the help of their physician to tell what they can afford and what they can't afford. Because the one size fits all does not work. Our major role is education of our patients. What am I educating them about? First of all is learning your narrative, knowing your body, checking yourself so that when you do go to the doctor, you're just not going to the doctor to say, I'm sick, but you can actually give good information to help the doctor treat you. That's one. And then 2, recognize we can't change our past. Our gene pool is locked and loaded, but your lifestyle is what pulls the trigger. And so for the nurse on the front line and for us as church members reaching out to our community, we've got to first learn who our community is. and so that we can meet them and repackage our health message in a way that they can receive it. Learn your narrative and then shoot from the gun that you've been given with the lifestyle that makes a difference. Thank you.
Good evening. This is Dewan Drakes, and I want to thank Dr. Watkins and Ursula for the wonderful information they've given. Speaking about Black health is one of the most profound things we can ever undertake. It goes back a lot further than we can even begin to imagine. And to try to explain it from a historical perspective will take far more than 10 minutes. So I'm not even going to try, but let me tell you some things that I have experienced as someone practicing medicine. Thing number one, in 1987, the federal government put out a study. The government did the study. Medicare did the study. And what they did, they took men of similar educational backgrounds, similar income levels, similar everything, except some were Black and some were white. And they sent them out to different emergency rooms and urgent care centers to make the same complaint. Oh, I got chest pain. And then they recorded what happened and how they were treated and what the government published. And this is in major cities now. This is not out in some rural backwoods area. What the government published showed, and it was published in 1987 in the Journal of Medicare, and it showed that the white patients with the exact same complaint got quicker treatment, better follow-up, and more consistent medication than the Black patient. Remember now, they're from the same educational level, the same income level, the same everything. But when they went to make the exact same complaint, the government documented that the treatment was different. They got treated completely differently, the Black patients to the white patients. And you would say, why would that happen? Because there's something that they're talking about. Since this Black Lives Matter stuff came up, a lot of things have been made public. And you have seen them on TV, on CNN, and all the different stations talking about the subconscious bias. There is such a thing as subconscious bias. And we saw it when patients come into the emergency room, Black patients, white patients, and they complain of pain. A lot of doctors would resist giving the Black patient pain medication because they think that the complaint of pain is just an attempt to get narcotics. And so they are biased subconsciously with how they treat you. And that may not seem like a big deal. But I always tell people, when you walk into a doctor's office and that doctor is a different ethnicity than you are, they subconsciously don't recognize you as a potential brother or cousin or sister or daughter or mom. They don't recognize you in that same way. So that kind of emotional input that they would need to do the extra mile and do the extra thing to take care of your health, they will never get it because subconsciously they do not regard you as equal. Here's an example. I had a patient that, well, not my patient, but it was a patient that had cancer of the lung and went to see a doctor at another hospital of another ethnicity. And the first impression of the doctor is like, okay, let's just do surgery. And so the family member came to me and said, why are they rushing this? And I said, let me explain something to you. You need to have someone else see your family member so they can do the necessary number of tests and different steps to figure out what would be the best option. It may not be surgery right away. It may be chemotherapy prior to surgery. It may be radiation and chemotherapy prior to surgery, but that has to be worked out or else the patient will not get the best treatment. That is just one story. As recently as Monday this week, right here, the Journal of Pediatrics published an article Monday this week. And in the article, it showed that children, Black children born to their mothers, have a higher death rate than white children. This was just published on Monday. And they were trying to figure out, well, what's going on? Why would Black children, they have nothing's going on inside of them. Why are they dying at a higher rate than white children? But that has been the story all along, where this ongoing discrepancy is so hidden under the table that you would never know. Because during her 9 months of pregnancy, when she was going to see doctors and so forth and so on, mark my word, she was not getting the same surveillance and the same evaluation as a white patient. And I constantly tell people that you have to be very cognizant of that. Here's another thing. Ursula was talking about the fact that your lifestyle and the food you eat is the necessary trigger to keep your body from going down the path that might be programmed to go. And she talked about a lady who bought, because of her income level and because of her situation, she bought her food from the dollar store, which are stores that sell primarily processed food. Well, let me give you a story that many of you have heard. You might not have thought seriously about it, but in this country, right here, there are places called food deserts. You might not have heard of a food desert, or you might have heard of it and never thought of it, but a food desert is a zip code or an area where people live, usually people of color, and there's no supermarket selling fresh foods and fresh vegetables and fresh fruits. All the food they get are packaged processed foods. So they call them food deserts. I'm sure you've heard of it. And there are many of them on the south side of Chicago, even in Southeast Washington, D.C. They finally got one supermarket built over there in Southeast Washington, D.C. But look at Northwest. Northwest has about 12 supermarkets. Southeast did not have one until about 2 years ago. And so people who live in those neighborhoods, in order to find fresh fruits and vegetables, have to take public transportation if they don't have a car and travel outside of their neighborhood to find a place where they can buy fruits and vegetables. It is not easy and it's not convenient, and that's why that doesn't happen. So food deserts are real, and they've been working on programs to correct them. And that is another issue, because if you don't get fresh fruits and vegetables, some of those same problems that you're programmed to have, you will have. Let me just show you something real quick. Here's a book. You might not recognize it, but this book is called Buried in the Bitter Waters. This is the hidden history of racial cleansing in America, buried in the bitter waters. And this book goes back to things a couple 100 years back. Now, you've heard someone spoke, like the Dr. Watkins spoke of the Tuskegee experiment. And you know what that was. That was an experiment where they gave the men syphilis and did not treat it because they want to study what was the effects of third-degree syphilis. So they never treated it. But you think that is the only study that they did? Oh no. News for you. When in the time of slavery, all of the GYN surgery that we now practice, like how to stop prolapsing uteruses and all those kind of things, that research was done on slave women who could not be admitted into the regular hospital, but because they were the property of their master, the master would donate them to the hospital for research. And they would do research on them, and there's books written about that. In fact, here's another book that I want you to look at. It's called The American Health Dilemma. This book is written by Michael Bird and Linda Clayton, and it talks about race, medicine, and healthcare in the United States. And there are many, many other documented books with this problem that has been looked at and studied, and people are trying to address going back for years. But again, the problem remains because there's a subconscious bias in the minds and the attitudes of the principal medical institutions in this country. And because of it, you continue to have those kinds of problems. And they're not going away anytime soon, okay? Until we can find a way of getting people to start thinking about themselves first and start recognizing that they are worth something and they can do better. Where they go pick a different doctor, do whatever they have to do in order to ensure that they get the best health care. The system is biased. The system is rigged against you, okay? And not because people out there trying to rig it against you, it is just a subconscious thing in people's mind. That subconscious bias allows them to focus on the majority of the population. Okay, that's one segment. The second segment is that if you look at the big pharmaceutical companies and the big corporations, their motive is to make money. I heard Dr. Watkins talk about trillions of dollars. That is their motive. You think they're going to be focusing on poor people to make those trillions of dollars? They focus on people who can pay $500 for a month's supply of pills. Okay, and to do that, you either have to have the means or the kind of health insurance that would allow you to do that. And unfortunately, a lot of poor, underserved, and minority people don't have that capability. So that is not the focus of the big pharmaceutical companies. And you need to keep that in your mind, focus in your mind on what you can do, though. And this is the final thing. What you can do, if you can get this population to start understanding that they can change what's happening within themselves by their lifestyle, what they eat, how they eat, the foods and drinks to avoid. If we can get this message out in some kind of way, it would make a revolutionary change in the healthcare system, first of all, because the people themselves would no longer be the targets. They would have a much better health. Here's an example. Langley Park, right up there from Metropolitan Church, has one of the highest obesity rates in the state of Maryland. If you walk into one of those restaurants in Langley Park, before the COVID, of course, you get these drinks, these free sodas and refill sodas with these high calorie things, which you'll get no questions asked. And people go there because they get these extra sodas and a refill free and so forth and so on. And that may seem like a wonderful thing. But when you realize the damage that those sodas are doing to your body, you will realize it's not that wonderful. That's why obesity is rampant in Langley Park. And I mean, I can go on and on. I don't want to do that. But if you ever get the opportunity, and there are many other books, this one, An American Healthcare Dilemma, is worth reading when we're talking about race, medicine, and healthcare disparities in these United States, because it's been going on for hundreds of years. And mark my words, unless we do something about it, it's going to continue to go on. Thank you.
Well, thanks for staying tuned thus far. I am excited. I want to thank all our presenters who have so richly imparted to us. And at this time, we will turn over to Odell to facilitate questions that persons may have for our panelists today.
I think I probably may want to do a little change here with the program. With respect to the questions, I'm going to ask our leader to introduce the core members of the team first and have them describe their roles. And then we will entertain questions for the panelists. And I will also encourage those who are online to post their questions in the chat. This will be monitored by our very own Dr. Andrea McDonald Thomas, and she would monitor the questions. We are trying as much as possible to manage the time that we have. So Trishana, I'll ask you to introduce the core members first, and after the introduction and each core member describing their role, then we'll entertain questions from the audience, the online viewers.
Okay, thank you, Odell. So last year, we had so many wonderful programs at Metropolitan SD as it relates to health ministry. And we have always been active in our community. And for any organization to run effectively, or any department, we have to have dedicated professionals, persons who are passionate about their role in health ministry. And I'd like to take this time before I move on to our current core committee members to acknowledge all our health ambassadors who have served faithfully at the Metropolitan Seventh-day Adventist Church for a number of years. We have, for example, Sister Gill, and she is one of the persons who has always been on mission trips. We have so many other persons that we could name today. Some persons have, they're now serving on our current committee, but we want to say a big shout out to all our health ambassadors who have served so faithfully. We love you, and without you, health ministries at the Metropolitan Seventh-day Adventist Church couldn't have come thus far. At this time, I would like to bring your attention to our Assistant Health Ministries leader. She was the Health Ministries leader last year, Dr. Andrea Thomas, and she is a pharmacist, and she also is so passionate about health ministry. And she serves on our team as administrative coordinator and assistant health ministries leader for this year. So I am so happy that Andrea has passed on her knowledge and her expertise in serving to me, and I look forward to a good partnership. And feel free to contact Andrea or text or email her, or information will be there on the website. Okay? Then we have Odell Basu. And of course, he introduced himself earlier, and he serves in the role of, well, he has a duality right now. And so he is multi-skilled, right, Odell? And he serves as our health monitoring and screening coordinator on our committee. Next, we have Margaret McCleary. She is our volunteers coordinator, and she will speak more as to her role as volunteers coordinator. Moving right along, we have Dorel McLaren. Dorel, she is an internationally acclaimed fitness and nutrition instructor. She has served on many boards. She has served as past health ministries leader here at the Metropolitan Seventh-day Adventist Church, and we are glad to have her serving on our health committee as food and fitness coordinator this year. Dorel, we love you and we appreciate your service, and we look forward for you to sharing what you will be doing this year and beyond. Next, we have Angela Brown. She is serving in the capacity of mission trips coordinator, and today she will demonstrate for us in a fun way how we need to stay safe throughout this COVID-19 crisis. However, Sister Angela works at the Howard University Hospital, and she has sit on several boards in our committee at our hospital, at our church, and we acknowledge her as serving before on the Health Ministries Board and currently serving now. And moving right along quickly to facilitate all the fun and the excitement that's going to come along, I will get out of the way, and then we will move to our members sharing with us what they will be bringing to Health Ministries this year. So let's get started.
Of course, I'm Margaret McCleary, the volunteer coordinator. And the appeal I'm making is that we need you. We are looking for a few good men, women, and children to help with our Metro M.O.V.E.S initiative. Service through health evangelism will require participation within the church and also in the community. During this COVID crisis, we see the need to help people within our church and within the greater community, especially with people of color, by informing them of ways that we can all implement better health practices by incorporating more preventative and proactive health behaviors. Our comprehensive health approach involves promoting the physical, spiritual, and emotional care as we aim to provide instruction and information through our exercise programs, or nutrition and cooking classes, or health fairs, as well as providing information on stress reduction and much more. These efforts will help to prevent or mitigate chronic illnesses like diabetes and high blood pressure, and could help boost the body immune system, the immune defense during this pandemic, and even when the crisis is eventually over. Again, as I say, I'm the volunteer coordinator of the Metropolitan Health Ministry team. I'm appealing for volunteers or ambassador teams to support us in this endeavor. The only requirement is that you have a passion for health and a willingness to serve. Training will be provided through the ministry if needed. And if you're interested in register online at metrosda.org/register. And you could go on that link and do the registration. And we look forward to hearing from you. Thank you.
All right. Thank you so much for sharing. Our well-abled assistant health ministries leader, Sister Margaret McCleary, you just heard from her. Up next, we have Sister Pam Lewis. And she's so special to us because she serves in a variety of capacities. Here on our committee, she serves as home health minister. And we really appreciate her service over the years. And she's going to share with you now what she plans to contribute to health ministry at the Metropolitan Seventh-day Adventist Church this year. Sister Pam.
Hi, good afternoon, everyone. As she said, I'm Pam Lewis, and I'm involved now with the home health ministry. Actually, we are dealing with the elderly, seniors at home with this COVID. Sometimes no one is giving them a call and or seeing what needs they have. So my role is getting involved. Actually, we have a list of the names of our seniors, and among our core members, we are calling them every week just to check on them. And I'm telling you, they are so appreciative of us for that call. Some doesn't have a need per se, but just the idea that you can call them and check on them, they appreciate that. So that's what I'm doing. And actually, I'm looking for volunteers too. We're looking for the young people. If the young people can get involved in calling the seniors, go through the Metro Ministry the line online and give us your information so that you can help in just giving them a call, just checking out if they have any needs, whatever it may be. Sometimes they don't have any needs, but just the idea of calling and checking on them, it goes a long way. And so, especially in this time, and if they have needs, we have, our church has the food distribution. We can get that information from them, and where we can probably see how we can get a food basket or something like that to them. And then I'm also asking if there's anyone who has any of the seniors, because there are some people who we do not have their names. If you can give us their names so we can get in contact with them and just check on them to see how they're doing, and also leave a word of encouragement, a script here, they appreciate that greatly. So thank you. I'm so glad to be involved as an ambassador in this Metro Move. And I just want to see how much more people we can get to volunteer so that we can make a difference in the life of our seniors and anyone who has a special need. Thank you so much.
Thank you, Sister Pam. Next, we have Dorel McCarran, and she will be sharing with us what she's going to bring to the table in a response to Black Health Matters and how we can help our community at this time.
As you can tell already, we have a lot of programs planned for you. It's going to be an exciting year, and we're looking forward to working with the community and to change lives. One of our goals in this ministry is to provide information and programs that will help to change lives in terms of health. And a bigger goal is to see Hyattsville to become a blue zone. I'm sure you're familiar with the blue zone, hopefully in the near future. And one such program, apart from the cooking classes and all the other health classes, my passion is exercise. And so we'll be, one of that initiative is to start a 5-week program. We don't have a date for you yet, but it's going to be a 5-week program that we will have on Sundays. We were trying to call it Sunday Steps, but it's more than just Sunday, because I want you to have something to do during the week. But on Sundays, we will meet as a group on Zoom. We may be on site, those of us who can go on site, but others will be on Zoom. And we'll meet from 7 a.m. in the morning, because I believe that we should start our day early, and our day will last longer when we start early. So it's from 6 to 7, 6 a.m. to 7 a.m. early rise. And it's going to be for 5 weeks. And during the week, you'll be given exercises to do, which we will want to see. So we're going to give you a program that you will download so you can track yourself. And at the end of the 5 weeks, you're going to show your screen on Zoom so we can know that you were doing it, and there will be prizes for the winner. There's registration that will be required to do that, because we want to track the outcomes. So we want to see where you started and where you ended up after that 5 week, and help you to continue. So participants will be required to register and to be ready every Sunday and during the week to continue with the exercises. This app that we're going to have you download will be for the entire church, if the entire church wants to download that, and also the community. And the goal is to everybody to see what everybody is doing and outdo everybody. That's my goal. So we're looking forward to big things this year. In terms of movement, that's one of our biggest goals. It doesn't matter if you're in a wheelchair or you're 2 years old, you can move. And so our goal is to show you how you can use what's around you. You don't need to join a gym or have any special equipment. Use a space where you are. If you just have a square tile, you can stay right there, and we'll show you how to maximize that space and get the maximum benefit out of it for your health, build those muscles, strengthen your heart, so we can get fit and be ready to do God's bidding and get ready for heaven. Thank you.
Thank you, Sister Dorel. And as we strive with our team to continue to shape our church and our community with these health initiatives, we cannot leave out our youth and our children. And I am so passionate about nutrition. As a dietitian and a health evangelist, I always seek to include our young people in our ventures and in our programs that we do. And so we are hoping to initiate, let me just announce, please register with your kids or your family. We will be having a cooking class program for our children. I can't hear you, but I want an applause. We are so excited that we'll be launching our Kids Cooking for Christ, and this will be in the format of a Zoom or a YouTube programming, and we'll engage our children to learn how to prepare vegetables and fruits and different food in a healthy way. It is not sufficient for us to wait until secondary care is needed, but it is important that we engage our youths to practice preventative measures. And so I'm excited, and I'll be working with Dorel, as one of her specialty is in nutrition. And we are just so excited. So please remember to sign up your kids as soon as we roll out the information and get our Metro moves with our kids going. I'd just like to follow up on a second program, as Dr. Drakes mentioned about obesity, and that's a very, very key factor with our people. We are having an obesity assessment program where you can come online and turn in some of your biometric information that will be guided by specialists who are trained. I will be one of the persons who will be offering free consultations by appointment only, please. And we will help you to plan healthy meal plans to guide you along health and healing. So we have a lot in store for you, and we're excited to partner and to serve our community. Now I will turn over to Odell Basu, who will explain to us how he serves on our committee and our church.
I'm gonna give my spot to Angela Brown to describe.
Everybody, let's just move right along. I have 2 minutes. I'm going to talk fast. I want you to listen fast and be with me as I demonstrate. My role in the team, of course, as you heard before, is to engage in our missionary work. I believe missionary work begins at home. So this doesn't really mean that we will always be going overseas, but we will have mission ground right here in Hydesville that we will attend to and serve the community needs. But today I'm going to actually give you a very quick demonstration on mask wearing. My role, which has been for 20 years, is infection prevention, and I have done, I'm the infection control officer at Howard University Hospital. So that means it's my responsibility to make sure that people are safe and that they're wearing personal protective equipment safely, which has to do with masks. Now I have here, I'm sure you can see, 1 mask, 2 masks, 3 masks, even this is a face cover. We see them all over. And so when I'm going around, what comes to my mind? Oh, America is filled with masks, here, mask, there, mask, everywhere, mask. Everybody has on a mask, but every mask is not the same. So I'm going to tell you a little bit about them and how you should wear them if you need protection. First of all, I'm going to give you some clues. I was looking at the University of Pennsylvania site, and there are lots of studies done on what happens when you cough. It is believed that when you cough, you expels 3,000 respiratory droplets. When you sneeze, you expel about 30,000. And when you're doing regular talking, you can expel over 2,000. So you can understand the need now that they say with the COVID-19, cover your respiratory. Now, Just so you know, there are N95s that you hear about. These are used in the clinical setting. People walk around with them, but they are really for the clinical setting. They are covering you from small up to 0.5 microns of organisms that come in. Then you have the cloth mask. I need everybody to understand that there's no data that says a cloth mask does what a regular mask does. However, when you wear a cloth mask, you can still hear me, right? So when you wear a cloth mask, what that does is prevent you from putting the organism into the community. And if somebody is close enough to you and they're letting out COVID-19, it will go into the cloth mask and it wouldn't get directly to you. However, if I would ask for a show of hands as to how many people wear these, I'm sure it's going to be everybody. And when the next question is, how often do you clean it? I asked that question of some students I was teaching. Of the group, only 1 or 2. But this mask, when you wear a mask, the outside is contaminated. So when you have it on, you must clean it every day before you keep putting it on, because whatever you're putting out in it stays in there. And so if you have COVID and you don't know, which some of us don't know because we're not tested, if you're putting it out in this mask, you're just breathing it back in if you don't clean the mask. Now, when I put this on, this is another one. I think I saw somebody with one on the call. When you have this, the front of it is dirty. So when you're taking it off, you have to take it off properly. This is a loop mask. So you need to put your hands, and everybody can see me, bring the loop out, then you take it off your face and you discard it. The N95 ones, for those of you who are clinical, when you put the N95 ones, each mask should have something rigid that you curve over your nose. That's what prevents stuff from going from the mask onto you. So in this case, I'm putting this one on. One of the strap goes to the back of my head, on my neck, my bare skin. The other one should be up top. Everybody who has a mold in their mask needs to mold it around your nose. See that? That's what's holding it from you getting anything in there. When you're taking it off, you have to make sure you do the same thing that I showed you before. Do not touch the front of your mask. Take it off and discard it. Now, what I have here is a mask, believe it or not, given to my son to wear. Well, I don't know why you call it a mask, but it covers your face. People use bandana. People use all sort of stuff. That's good in this case because you're stopping the volume from going into the community. That's what you want to understand. However, one of the most important things that everybody, when they talk about masks and social distancing, you don't hear them talk too much about is the fact that before you put a mask on, your hands must be clean. And when you take it off, you must clean your hands again. Now, I'm sure if I ask, everybody has somewhere in their purse a little bottle of sanitizer. So I'm going to show you how you sanitize your hand, and then you can ask yourself, is this how I'm doing it? So I'm going to take the sanitizer in my hand. I don't know if you can see it. First of all, most people clean the front of their hands. But when you do that, you need to also do the back of your hands. See, the organism can be in the back of your hands. Then you're going to ball your fingers and you're going to do your fingernails. You just went in the supermarket touching everything. You pick up all the fruits and leave what you have on the fruits for somebody else. You do both of them. After that, then you go in between. That's how you do it, whether you're using running water or whether you're using sanitizer. We say do it for 20 seconds. By the time you do all that I do with the sanitizer, you would have reached your 20 seconds. Then you have clean hands to go eat your food, to touch your children, whatever you need to do. Now, I could ask the question, how many of you are doing it this way? If you are not, please practice doing it that way. Please remember, they are masks and they're masks. They're not all the same. A cloth mask cannot take, it gets wet. It is only good for use outside. If you're in the clinical setting, you need to use the approved mask. grade 2, level 2 or 3 inside the clinical setting. And when you're using an N95, it is not really a mask, it's a respirator. All right, I'll take your questions at the end. Thank you very much. I think I took my 2 minutes. Thank you for listening.
Okay, thank you. My role, as you have heard, I am the screening coordinator. Especially during this pandemic, we have heard a lot about testing. And you have heard before that early detection saves lives. And that is our goal. Our goal is to serve the underserved, those who are uninsured or underinsured, both in the church and also in our community, our surrounding community. I won't spend a lot of time on that. We have done a number of those activities in the past, but in the interest of time, I think you will understand the gist of my role. That is nothing new to most of you. I want to move straight to the question and answer period, and I'm going to start this out. And the panelists any one of the panelists can address the question that I'm about to ask. We have heard so many things, and we have received lots of information this afternoon about health disparities and the experiences from all of our panelists. My question is, we have seen, and many reports, many of the scientific journals have reported that there's been a 6-fold increase in the rate of death for among African Americans due to the COVID-19. This is a moment for me of ethical reckoning. The scourge of COVID-19 will end, but healthcare disparities will persist. What do we do as a church? What is the action plan? Is it more of an action plan or more of commitment? Do we as a church chronicle all these experiences and outcomes and park them in the health disparities column? What is it do we plan to do as a church to serve our communities around us and further afield? That's my question for the panelists. Any suggestions? What are some of the things we can do immediately and also in the long term?
Well, as my presentation indicated, I think that, the Seventh-day Adventist Church has some unique skills and perspectives. One of the things that we have to do is we have to look at the population that we're serving, and we have to find ways to communicate with them. It's hard to teach what you don't know, and to lead where you don't go. And so one of the first things that we need to do is some of the things that you are doing there at Metro. We have to get our members really engaged in lifestyle change. It's important to knock down the barriers to healthcare throughout the community, but we really have to also engage people. One of the things that I've done a lot during this COVID-19 is look at ways in which we can build our immune systems so that we can fight off the virus, or if we get the virus, be able to have decreased impact. We need to recognize that this virus is probably going to be around unless the Lord intervenes for the next year and a half, 2 years, at least by some experts' opinion. And so we have to move beyond the virus. We have to deal with people are still dying of heart disease. They're still dying of diabetes and kidney failure and so forth. And so I had a patient call me this morning 7:30, Duan, because he went to the doctor yesterday, cardiovascular surgeon, and he had some blockage in his leg, and so he had to open those up. So it's very important that we, as individuals and as a church, reach out into our community as we reach out into our own church members. Charity begins at home, and then it spreads abroad.
And let me just add on to that we need to start from the bottom down, up. Don't wait on the higher ups to set the example. We have to do it from the bottom up. Because if you wait from the higher ups in the organization, they have adopted almost like a segregationist attitude. And we have got to stop that. Let me give you an example that shocked me. In North America, just recently, we elected a North American division president who happens to be a Black guy. And when they look at the demographics in North America, the population in our church, in the Adventist denomination, is mostly non-white, not just in North America, but around the whole world. My whole thing is, don't wait on the top leadership to adopt the attitude. We have to do what we are doing now. Reach out to the community where we are. I think Darrell mentioned how we are thinking of making Hartsville a blue zone, and every church should think of making their region in that same manner, help them to become healthier. Whatever it takes to help people to understand that need, we need to do that, because that is what Jesus would have done.
Very much. Dr. Drakes, I'll now turn over to Anja, who may have some questions from the chat that she would pose to.
Hi, good afternoon, everyone. So we're winding down, and in the interest of time, there are about 2 or 3 questions. And we had some problems with the chat freezing on us, so we just have time for a few more. One question was asked is that how can we motivate our community leaders to address the food desert issue? Dr. Drakes mentioned that. I don't know if he had any suggestions or if any of the panelists did.
Yeah, I think that unfortunately, when you're talking about community leaders, that's a political issue. And politics is a powerful tool, because if they want to get back into office, they got to address the issues that are plaguing the people, but the people have to be made aware of the issue. And if the people are made aware and are motivated, then anybody who wants to represent them will have to have that same motivation and correct these food deserts. What I have seen in some of the craziest places, some of the stores that were not necessarily supermarkets, like Target and Walmart, became supermarkets in some areas, serving fresh fruits and vegetables, only so that there could be a source. And if they can have that attitude, then I think that it would be beholding if, as an organization, we find a way of getting the political leaders to make that a priority in every community where that kind of thing is happening. Wherever there's a food desert, there really shouldn't be anymore. But people,
I would suggest, it's nice to get the political leaders, but we have to start our own. The political leaders have known about the food deserts in Southeast Washington for many, many years. The only reason that they're now a supermarket there is because white folks start gentrifying that area, and so we can't wait on them. Churches like Metro, churches like Brinklow that I represent, we can come together and we can start doing our own. There have been several very good markets that the community have done. One of the problems is we have to really educate our people so they will support them. There was one on New York Avenue many years ago. There was another one in Hyattsville, and they served really fresh fruits and vegetables, nuts and so forth. You know, we can come together and we can build ourselves. We're not impotent. As a community, we have a lot of power. We have a lot of expertise. We just have to have the will to do it.
Thank you. All right, so we're winding up. We have time for one more quick question. I think that is important. The question was posted, Sister Angela, about what you recommend for wearing masks when exercising. And then we'll move to our door prizes because we have to wrap up in about 4 minutes.
Okay, it is recommended that as long as you're going to be in close contact, you would have to wear a mask. Now, the exercising is going to cause you to breathe faster, and you're going to be putting more of the virus into the community. So when you're exercising, the best thing is actually to make sure you have that distance, or else they will have to be in mask. We cannot remove it.
Okay.
What I suggest, Darrell, is that you give breaks so that people, because it's going to get hot, give them some breaks so that they can either go outside, go far away, take a breath with the mask off. But during the exercise, they're going to have mask on, and you have to maintain that distance. One of the things that I see often is people have mask on, but the mask is below their nose. It's really not defeating the purpose of the mask. While you're doing it, you have to keep real good, strong vigils to make sure that that's happening correctly.
All right, thank you so much. All righty, so we just have about 1 to 2 minutes to do our door prizes. We were gonna ask questions and have little quizzes, but in the interest of time, we are going to do a random giveaway. So I'm just going to let you all know what the various door prizes are and the names of the winners, and they will be contacted to be informed of what prizes that they will be receiving. So we have 2 $50 gift cards for Amazon from our sponsor, Adventist Healthcare, Faith Community Health. So we want to thank Kathy Coleman for that. We also have 1 $25 gift card donated by a church family for Visa. We have a Fitbit tracker, 1 to give away. We have 2 water bottles. The water bottles actually are going to the very first person who registered for door prize and the person who made it before the cutoff. So those 2 people are George Kerr and Veronica Williams. We want to congratulate them. Also, we have a pack of masks and hand sanitizer to give away, highlighting what Angela Brown reviewed. We also have a small children's t-shirt. Trishana, if you could hold that up. And we also have a children's cookbook. We didn't want to leave them out. It just says, Jesus thinks I'm one in a melon, and it has a picture of a watermelon on there. And we also have a $70 gift certificate to New Vegan in College Park for a couple to enjoy dinner for 2. So I want to thank all of our panelists for the program today, Dr. Dewan Drakes, Dr. Watkins, and our nurse, Ursula Allen, for their participation, as well as all of the members of the Metropolitan Health Ministries team, our leader, Sister Trishana Holman. Also, I would like to, and our other assistant leader, Margaret McCleary. I wanted to remind you all that we have some upcoming programs. There's the Flow program starting at 4:30 today. And also we have a upcoming mental health program entitled Permission to Feel. It starts Wednesday and it runs through Sunday. During the week, it's at 7:30. Sabbath, we have service at 11:45. And we also have an afternoon program on moods, foods, and attitudes. You don't want to miss it in the afternoon. And Trishana, you got about 30 minutes to wrap up and pray, please. 30 seconds, sir.
I figured you meant 30 seconds, Andrea. Okay. So here at Metro Health Ministries Department, we have not only looked at our challenges that Dr. Drakes and Dr. Watkins and Sister Allen spoke about, but we had to come up with a solution that we can do in our neck of the woods and in partnership with other churches such as Pisgah Seventh-day Adventist Church. Just want to give a quick shout out to them. Their leader is online with us, Miss Leola Gilliam. And we will be partnering with our community moving forward with the model Metro Moves. So Metro Moves is our response in serving our community because there is a great need and we all can play a role. Now, Metro.M.O.V.E.S is an acronym, of course. The aim of this new initiative and rebranding of our health ministries department is to further reduce the risk of developing non-communicable diseases for our members as well as for our community through motion. So our M is for motion, and please listen carefully because Andrew might just ask you a question in the chat so you can win a prize. M is for motion. O is where we strive to overcome obesity. V is where we'll be educating you about your valuable veggies and how you can incorporate these in your diet as preventative measures. E is for emotional health. It is so vital in this challenging time with racism and corona and the different impacts on our health that we protect our emotional well-being and our relationships. And Metro.M.O.V.E.S will be rolling out programs to help our church and our community in this initiative. And finally, we strive to serve our community, as it is our motto at Metropolitan Seventh-day Adventist Church, to connect our church and community to Christ. Our model will encompass the tool of health evangelism. We have a work to do, and we have to do it quickly. Christ is soon to return, and health is one of the major ways our community is looking to us to serve. So I'm excited that you could be with us today. Please respond positively to all our programs and our offerings that are coming up. And remember, you are an health ambassador for Christ. Thank you for joining us today. I'm excited about Metro.M.O.V.E.S. I'm excited about what we're going to do and how we're going to partner as a church and community moving forward. And God bless you and have a wonderful afternoon.
All right, let's bow our heads for prayer. And just before we do that, I'd like to thank our communications team for helping us to coordinate this program and our pastoral staff. Please bow your heads for prayer. Heavenly Father, we thank you for this day. We ask that you forgive us of our sins and for the gift of your Son who died. We ask that you encourage us as we move forward to promote our health ministry, to share with the world that they may be saved and live happier, healthier lives, not just in our church, for our community. We thank you in Jesus' name. Amen.
Amen.
Thank you.
Bye. Healthy, happy regards. Stay in contact with us. Bye-bye.